Okay. I want to welcome everyone tonight. We are about to kick off the meeting. My name is Gina Owens. I am from Washington Community Action Network, and I am one of the two co-MCs for tonight. If everyone would please introduce yourself in the chat with your name, your gender pronouns, and the organization you're from. Also letting us know if you are one of the designated voters for our sponsoring organization. That would be great. Please put all of that information in the chat as we get started. Let's acknowledge that we work and live on the unceded lands of 29 federally recognized tribes. Tribes currently without federal recognition, tribes with ceded land in Washington state, the Wamish, Wanapum, which are not pictured, Chinook, Coeur d'Alene, Nez Perce, Umatilla Confederated, and Warm Springs Confederated, shown on the slide. They have been here since time immemorial and are still here. It's especially important that we learn from and lift up the many tribes and perspectives as we together create a universal healthcare system in Washington state. As you notice, there are links on the slide where you can learn more and also put your information into the link, and it will show you which land you are located on. Supporting Native-owned businesses.
I believe we have a little bit of a freeze frame here with Gina.
Right.
Gina, I think you're in a freeze frame. It's not coming across.
Should we turn off our videos?
Good. Can Nathan take over? He's on. Or David, one of our co-hosts.
And of course, her minutes have just about expired. So.
Okay. Can we move to the
maybe if I can
slide?
share, I may be able to share some of Gina's notes, if I may. Would that be?
Go ahead. Yeah, that's very good. Thank you.
All right, I'd like to kind of slip in. I think what she was trying to complete was I think it's important to read the last line here as part of her presentation, that it is absolutely, especially very important that we learn from and lift up the many tribes and perspectives as we together create a universal healthcare system in Washington state. That is very, very important. And there are links on the slide where you can learn more and get more engaged, paying rent to the Duwamish or supporting Native-owned businesses. Very, very critical. The thing that Gina was going to walk us through here, we're going to look at how things went in 2021 with a spotlight on 3 key victories: the Universal Healthcare Commission, the Cascade Behavioral Healthcare Worker Strike, and the House passage of Build Back Better. And then we will focus on the proposed 22 the HCHR policy platform and vote to adopt the policy platform. There will be two Q&A sessions tonight, one following Rachel Berkson's update on the Build Back Better, and the other following the review of 22 policy platform. So feel free to submit your questions on the chat. And then to summarize our time together, we ask you also put the good of the order event announcements in chat as well. Good of the order, the second Universal Healthcare Commission meeting Tuesday will be January 4th from 2 to 4. So you'll be able to do it on Google HCA-UHC Commission to see meeting materials, link, and testimony information. One piece of business, speakers, Maureen Brink Lund, who serves as co-chair of our HCHR Universal Healthcare Commission Committee, will be our timekeeper tonight. So we have that. Maureen Brooklyn, co-chair who is our chair also with the HCHRC Universal Healthcare Commission Committee, as part of the League of Women Voters and the North Seattle Progressives. So Mo, I'll turn it over to you for a minute to say hello.
Oh, great, thank you, Jesus. Hello, this is my first meeting of this kind to be here, and I'm a timekeeper tonight, so I'm gonna do my best. There's a tone like this when your time is up, or when you've got a 1-minute warning, and then a double tone, if you can hear that, when you're done with your time. So I've let it slip now because we had these technical difficulties, but Jesus, you only used about 1.5 minutes more, so
Okay.
I think we're on.
So all right, so I was going to introduce myself. I'm sorry, I should have introduced myself initially. But I'm Jesus Sanchez. Buenas noches, good evening. Espero que todos están bien. I hope that all of you are in good spirits and doing well. I'm Senior Vice President for Operations for Seymour Community Health Centers, and I joined the HCHR Steering Committee last year. And I do want to say I'm in this, and it was been extremely gratifying to be on this committee, partly because my commitment to this has been a lifelong endeavor with CMAR. I've been a supporter of CMAR for 25 years as a volunteer, for 25 years before I actually joined CMAR. But the commitment is based on a history of neglected communities, of which I was a part of as a farm worker living in labor camps with my families. And I know only too well the institutionalized walls that have been placed over so many years, keeping us from something that should have been a right 40 years ago. And today we're still fighting for it. So my commitment continues, and generationally, we hope we don't need to continue doing that this stops at this generation, and that we continue to grow in a stronger fashion as a committee and as organizations. You guys are absolutely critical as everyone plays a major role. So I want to say thank you for your commitment as organizations. We're in it all together. And I thank you for that. Gina, looks like you're back. Oh. All right.
Now you got unmute.
Okay.
You're muted, Gina.
Okay. Am I off mute now? Okay. Thank you, Jesus, for stepping in for me. I don't know what happened there, but anyway, I'm back. And I think I'm supposed to be introducing myself now. I really like the story that Jesus just told. And I'm going to just briefly go over mine as the other co-MC. Part of this work is because a lot of, well, my story goes back to 2010 with the ACA bill, and my grandchild, Marcellus Owens, with Obama, was nicknamed the Obamacare kid, and all that story is history, but I'm still involved in the fight because I still believe everyone straight across our country should have access and insurance healthcare. And I want to make sure that Medicare for all and the universal healthcare is always a part of the conversation until we see one of those two pass. So with that, I'm going to turn it back over to Jesus.
Thank you, Gina. So at this point, here are a few highlights that I think Nathan will take us to in 2021. And let's look at these slides together and show what some of these key pieces are. First, our many Washington legislative session by the coalition and the allies. I think it's very critical. Permanent UHC Commission, 1-year Medic postpartum coverage, increasing immigrant access, capital gains tax, Cascade care subsidies, and hospital financial transparency was really important. The sustained federal advocacy with national partners, and the health public forums to teach in on Medicaid for all and Medicaid expansion affordability. Wonderful wins. And we just have to keep growing with that. But it's go to the next slide. I think we have anyone. Okay. And then also the WSLC Convention Healthcare Resolution endorsing Medicare for all, the Washington Legislators' letter to congressional delegations supporting the state-based Universal Healthcare Act. That's great. And then also nominations to the Universal Healthcare Commission that happened this year. It's great to have that and have one of our members on that committee. It's really been good. And now we're going to do a welcome to our new 2021 HCHR members. And so here's our list of our members. I think it's okay to go ahead and list. I'd like to read them off. I think it's important, as opposed to just looking at them and remembering them. I think it's important that we call them out. So the American College of Nurses, Midwives, Washington affiliate, the Asian Pacific American Labor Alliance, AFL-CIO, National Organization for Women, Washington, the Somali Health Board, the Washington #Insulin for All, the Washington Federation of State Employees, and the Washington Poor People's Campaign. And our new allied, these are our sponsoring members, excuse me. And then our new allied members is the American Indian Health Commission of Washington, National Alliance on Mental Health of Washington. Welcome and thank you for being a partner with us in this fight for universal health care. In the year ahead, we want to press forward with the ambitious goals stated on our policy platform, again, making progress towards universal health care in Washington State, improve the healthcare affordability and access, driving down escalating industry profits, advance the racial equity and address social determinants. And I want to just under equity and address social determinants of healthcare disparities. It is a very critical piece. It's just as I really want to call out and shout out for that and ensure that no one loses.
Thank you. And thank you, Jesus, and everyone for inviting me to say a few words about the Universal Healthcare Commission. This is the big win of 2021 in our book. So why is it significant? Well, because it's a permanent body charged with designing a healthcare system that will cover every state resident under a unified financing system, putting Washington on track to be the first state in the union to do this. The financing of plan is always the sticking point. This law directs the healthcare authority to apply for federal waivers as soon as they are available. They're available now under Section 1332 of the Affordable Care Act. These waivers would provide access to federal funds and support that Washington needs to fund our universal healthcare system. It builds on the work done by the Universal Healthcare Work Group that preceded this commission. And universal healthcare advocates are in the House. There are 15 total members, 4 legislators, 5 agency heads, and 6 members of the public appointed by the governor. All 6 of those members were nominated by Healthcare as a Human Right and/or Healthcare for All Washington, including the chair, Vicki Lowe, who also served on the Universal Healthcare Work Group, and she brings that experience to this commission, as do several other commission members. And the meetings are open to the public. Plus, public comments are encouraged. So great job. How did this get passed into law? Well, number one, the pandemic itself. Pandemic highlighted the desperate need to improve Washington's public health and health delivery systems. The lockdowns created the need for remote testimony on bills. That resulted in a 3-fold increase in public participation over the 2020 session. The persistence of universal healthcare advocates is very important. For decades, single-payer supporters have organized and advocated for Washington to design and implement a universal healthcare system for our residents. Then, in 2018, key legislators on the healthcare committees worked with Healthcare for All Washington to draft the Pathway to Universal Healthcare bill for the 2019 session. This predecessor to the commission bill called for a work group of diverse individuals to meet and make recommendations to the legislature on the healthcare system that would best cover and care for all of our residents. A coalition of Healthcare as a Human Right and Healthcare for All Washington members and government affairs professionals lobbied hard for the Pathway bill and several key amendments. It passed the Senate, the House funded it, and in 2019, the Universal Healthcare Work Group was established. Kelly Powers was a member of the work group, and thanks to the pre-meeting strategy sessions she convened as a subcommittee of the Healthcare as a Human Right Policy Committee, advocates were well prepared to deliver personal stories and focused comments during each meeting's public comment period. Research done for the work group by the actuarial consultants found that Washington could provide healthcare for every resident and save billions of dollars in healthcare spending statewide at the same time, if the system were publicly funded and administered. The work group didn't have the time or the mandate to design such a system and recommended that another entity, a Universal Healthcare Commission, be created to do that work. Again, continued strong support from advocates, lobbyists, and legislators succeeded in drafting and passing Senate Bill 5399 and getting it signed into law. The Universal Healthcare Commission began meeting this last month, and so did Kelly's and co-chair Maureen Brink-Lund's Universal Healthcare Commission Strategy Subcommittee. So the outlook is pretty good for further progress. There were a couple of other wins that will support the work of the Universal Healthcare Commission, and those in 2021, and those are Senate Bill 5203 that authorizes the Healthcare Authority to collaborate with other states or entities in the production, distribution, and purchase of generic prescription drugs and insulin, lowering the price of prescription drugs in our state. And then there's House Bill 1272 concerning health system transparency, which requires hospitals to report revenue, costs, and disaggregated data on patients and providers. We've already talked about the next UHCC meeting, which is January 4th. I'm going to put a link in the chat for to subscribe to this topic so you can get notices and information about these meetings when it's available from the Healthcare Authority. If there's time, I want to just give a shout out to say that it's urgent that the Healthcare Authority receives sufficient funding in the 2022 supplemental budget to activate these laws, 5203, 1272, and plus the existing Healthcare Cost Transparency Board, which is charged with providing the data needed for the Universal Healthcare Commission's baseline report, which is due in November of 2022. So thank you very much. And if you have questions, I'd be happy to answer them if time allows. Thank you.
Thank you, Marcia. That was very informative and certainly very detailed, and certainly appreciate that very much for all our members. Again, thank you for your time. I'll turn it over to Gina now at this time and introduce our next presentation on Cascade Behavioral Health and Safety Strike Workers presentation. So Gina, turn it over to you.
Thank you, Jesus.
You bet.
What can I say about Cascade Behavioral Health Safety Strike Workers? Oh my goodness, that's a big one. I'm going to introduce two people to you that are joining us tonight to talk about that. Sarah Moalin and Meseret Amari. Sarah and Meseret worked at Cascade Behavioral Health in Tukwila and are SEIU 1199 Northwest members, fresh off of successful 3-month strike. So welcome, Sarah and Meseret. Take it away.
Hi, my name is Sarah Moalin. I'm a registered nurse at Cascade, and I've been there for the last 11 years on and off. And I thank you guys for having me here today and all that you guys do. We are a behavior hospital in Tukwila, parent company located in Franklin, and very, very greedy and our community was going through. So we decided to stick together and go out for a safety strike. And we have been on a strike for 95 days, which I believe is like over a little bit less than 4 months, but over 3 months. We have endured a lot of challenges in that 95 days, but the outcome outcome was really great. We won, we won safety for our patients, safety for our community, for our coworkers. We think it was worth the fight and the struggle. I want to thank all the supporters who supported us throughout those 95 days. Everybody who believed in us, and the county who supported us in so many ways for standing patient safety. Great. It was not easy. But I do it again if it was for my patients again. But it was one. Excuse my. We went through a lot. They've called the cops on us. They put the fences on us. At work for 7th, and so we can overcome the challenges. And I'm gonna let Master say a little bit of Messi.
Hello, everyone. Thank you for having me here today. And my name is Meseret Amara. I'm working at Cascade Behavioral Hospital since 2015. And as a mental health technician at Psychiatric Hospital in Tukwila, we work with a patient going through recovery at all stages, and sometimes they can be violent. And my employer, Cascade Behavioral Health, rejected our request for trained security staff to help us, when crisis happened. And we were at risk, our patients were at risk, and we said enough is enough. And that's why, I joined what became like a 3.5 month strike at Cascade Behavioral Health Hospital. After months on the picket line filled with lively chants and community support, we won a new union contract that meets our demands for a safe workplace, benefits nurses, healthcare workers, and patients, and set a new standard in behavioral hospital. To win, we had to take on our hospital owners, Acadia Healthcare. This multi-billionaire dollar corporation is one of the biggest behavioral health providers in the US. When Acadia bought our hospital in 2014, the corporation made changes that include eliminating our hospital security. And for me, as a nursing assistant for more than 12 years, I have provided care in nursing homes, assisted living facilities, hospitals, and in home care. But I love making a difference in the life of mental health patients the most. At a Cascade, many of our patients are admitted from jail or a local emergency room. Many are young, have suffered from trauma of some kind of suicidation. They've been through a lot, and it is my priority to take care of their needs and provide them a safe place to recover. But we have to care for our own safety as well. Sometimes patients become violent or aggressive, and that's why we walked out from our job to demand the security staff we needed. Like many of my coworkers, I'm an immigrant. I'm a part of a big Ethiopian community in Seattle, but I didn't realize how powerful we could be by standing together against a big corporation. Through our union, we built strong relationship with each other on the picketing line every day. We were joined by community leaders and other union members. We told our story to the media. I joined a delegation of coworkers who went to a behavioral health conference in Washington, D.C. to deliver our demand to Acadia executive. We refused to give up, and we won our demand for the security we needed. The security we will have is not a police or security like at store. We asked for, and we'll get security staff who have trauma-informed training and can ensure that when a patient may harm themselves, us, or other patient, we have the backup support we need. Solidarity is a winning ingredient. We all need to use more. My story is a proof that by striking together through our union, we workers can accomplish so much more for ourselves and for those who serve. We are back at the job we love, caring for some of the people in our community who need it the most. Thank you all for having me. Thank you.
Thank you both for being there. I really believe in powerful story. So thank you for both of you telling yours. And thank you, SEIU 1199 Northwest workers. The Cascade workers' victory is crucial to the national struggle to get hospitals and providers to pay workers fairly and ensure safe working conditions and help strengthen our healthcare force. I am pleased to announce an introduction of Rachel Berkson, Representative Pramila Jayapal's district director, to update us on the Build Back Better and how we can support its passage in the Senate. Please drop questions for Rachel about the Build Back Better in the chat, and time allowing, our co-policy committee chairs, Sam Hatzenbeller and Emily Bryce, will choose a couple of them. Welcome.
Hi, thank you, Gina. It's good to see you. And thank you, everyone, for all the work you're doing. I know the Congresswoman would love to be here herself tonight. It's been a really busy time, as I'm sure everyone has seen. I was really hoping that I could start off my presentation by telling you that it's definitely going to pass in the next week or so in the Senate, or definitely before the end of the year. I'm sure that most everyone has seen that there are some hiccups in the Senate, at least in what folks are saying. We can get into that later. But we're still pushing really hard to get Build Back Better passed through the Senate by the end of this year. I was with the Congresswoman earlier, and she was pushing away on that. So you know that she will be continuing to fight on that. But first, I just want to thank all of you here who are part of the coalition, who are doing this really important work on healthcare justice in both Washingtons. And that's something that our team deeply appreciates and notices all the great work that we do. And we love collaborating with all of you as a coalition and the different groups individually as well. You know, I also wanted to reflect back. I'm trying to keep on the positive, because the fact that this bill passed the House was a huge victory. And it was a huge victory, if I do say so myself, for the progressive movement and for the Congresswoman who leads the Congressional Progressive Caucus. It was definitely not a given. Just to go into somewhat recent history, the Build Back Better bill and the infrastructure bill were all initially part of Biden's initial plan to build back our infrastructure, our social infrastructure, our physical infrastructure. And throughout the year, that really got separated into two separate bills. And the Congresswoman and the Congressional Progressive Caucus were clear from the beginning that these were essentially one bill and should remain one bill. And if we wanted the president's agenda to succeed, and for us to continue to move the country forward, we needed to pass both bills together. And we truly believe that the reason that Build Back Better did pass the House and is in the situation that it's in is because that the Congressional Progressive Caucus's 96 members were able to stick together and say, we are not going to vote for one bill without the other. Now, they did vote for the infrastructure bill slightly before the Build Back Better passed the House, but eventually it did, shortly thereafter, it did pass. And that was through a lot of work with the president, a lot of work with Democrats all across the spectrum, and in consultation also with the Senate. So we are hopeful that this bill will pass. Next, there is I think a message that the Congresswoman recorded that really lays out what's in the Build Back Better bill, at least as, you know, what was in the version that the House passed, that a lot of components of that will be in the bill that the Senate passes. So I think we were going to pause now and show that video. This was recorded the night that Build Back Better passed on November 19th.
Well, I am so proud of Democrats today. I'm so proud of President Biden. We are delivering on universal child care, where most families are going to see their child care costs cut in half. We are delivering on universal pre-K. Every 3- and 4-year-old across the country will get pre-K. We are delivering on housing. We are bringing down the cost of housing and making the biggest federal investment in housing since our history. And we are taking on climate change and really cutting carbon emissions appropriations with a $500 billion investment in taking on climate change. We're also bringing down the cost of pharmaceutical drugs. But families are going to see that they're going to be able to pay $35 for insulin instead of hundreds and hundreds of dollars for insulin. So we're cutting costs across the board. We're investing in our next generation. We're investing in our planet. We're investing in our immigrants. And it is a big day for the country as we move this bill one step closer. Of course, the Senate needs to do its job now, but I am confident we are going to get that done.
If we can, Congresswoman. I know you wanted assurances from Senators Manchin and Sinema before this vote happened. You didn't get them. How concerned are you about potential changes to the bill once it goes to the Senate? How optimistic are you that it gets passed looking very much like it does now?
I feel very good about this. There was a framework that was agreed to. The vast majority of this bill is pre-conferenced with Senators Manchin and Sinema. I have had my own conversations with them, but this is again a place where President Biden has shown tremendous leadership. He had those negotiations, and that is why we ended up at the bill we ended up at. Now, there are a few things that aren't pre-conference. We're going to have to work those out, but I believe through my conversations and with those senators, as well as the president's own commitment that he is confident we can get 51 votes, we're going to get this done. And we're going to get it done before Christmas, hopefully in the first weeks of December. And people are going to see once again that government's got your back, that Democrats in the House, the Senate, and the White House delivered for them.
If people do have questions, I think we have a minute or two left for Rachel. That was an incredible presentation. I wanted to just ask you a little bit more about the latest thinking on timeline. The video mentioned before Christmas, you were saying, well, we're still going to try to get it done. Is there an end date that we have to keep in mind? Like, this is the hard stop. This is definitely the hard stop. It has to be done by this. Or should we just kind of be pushing for, it's got to get done in December?
I think we should keep on pushing. It's got to get done in December. Now, I think there's a chance that won't between us. That may not happen, but I do think that is what we're pushing for. And I know that's what the Congresswoman is pushing for with her colleagues. I think there's a lot of concern that as we get into 2022, it's an election year. So it's harder to get big legislation done. That's just a fact. And there's more time for it to get eroded down. And I think we want to keep it as strong as possible. And the best chance of doing that is in December. And I think the more we push on December, whether or not it gets done in December or bleeds into January, I think we have a better chance of creating that urgency and actually getting something done as soon as possible. And so we're really hoping that, folks who support this legislation, and I know you all do, and really want to see it done and understand all the amazing benefits and how transformative it will be for people's lives, know that, we have got to get this done and, convey that urgency to the senators and not really take any excuses of, we have to do vote. Of course you have to do voting rights. You can do both voting rights and Build Back Better. We really don't want these two issues to be pitted against each other. We want to see them both move and both move this year. They're incredibly important.
Thank you. And I want to lift up in the comments some commentary about Representative Jayapal as next Speaker of the House, just an idea. And just maybe one last question while we've got you, Rachel. You mentioned some of the provisions are at risk of slipping in the Senate from the House passed version. You mentioned the insulin provisions. Are there other pieces that you're really worried about that you just want to keep our eyes out for and really be advocating for?
The thing that I was seeing there are discussions on today, and I'm sure everyone else has seen, it's not related to healthcare, but is related to the climate provisions. And I'm happy to send around a letter that the Progressive Caucus sent out on the issue. And that's, an area that we're watching really closely. And also the child tax credit, I think, as well.
Thank you. All things that affect health and wellness in our country. So thank you so much for that, Rachel. I think I will just thank you again. Applause for Rachel. Thank you so much for all your work. We really appreciate it. Yes, good. And I'm going to transition us now into our 2022 policy platform, which includes some of those things from the Build Back Better package. So thanks again to all the folks who spoke about 2021 victories for our movement. It is thrilling all that we accomplished together in 2021 in the midst of a pandemic, mind you. Now let's discuss how we can build off these wins for 2022. And I'm going to turn it over to my policy co-chair, Sam Hatzenbeeler, for our introduction to our policy setting process and the state legislative framework we developed in the policy Committee of HCHR with everyone's input. So Sam, take it away.
Thank you, Emily, and just thank you, Rachel. It's just always great to hear from you and Rep. Jayapal. So so it's an honor to be co-chair with Emily. I love serving on HCHR's policy committee. All right, so without further ado, I wanted to give more detail into our proposed policy platform that we're voting on tonight. And this has really been developed as an iterative collective process with the policy committee and also with the steering committee. So just want to thank everyone for all of your time, for putting all of your thinking and brilliance into this so it can guide our work at the state level and federal level in the coming year. So these are our goals here on the screen, and thanks Nathan for being our slide master tonight. So goals guiding our work in the coming year largely are similar to last year. I'll go over them. Make progress towards universal health care in the state and the country. That of course is our guiding light, our North Star. Improve healthcare affordability and access. And this next piece is new while driving down escalating industry profits. That is something that is increasingly crucial for us to address, particularly hospital profits and insurance carrier profits, as they escalate their gains at the expense of patients and patient access to care. Next one, advance racial equity and address social determinants of health and disparities. And lastly, ensure that no one loses access to care and strengthen existing programs. So next slide, Nathan. We'll get into our filters. So we created this last session. We really wanted to have a strong process for evaluating specific pieces of legislation, whether or not we want to support them. So again, largely similar to last session. I'll go over there. There's four questions we put bills through, bills and budget items. Number one, does the issue enhance and support the mission and goals of HCHR, Healthcare as a Human Right? Number two, does this issue advance equity and or move our state towards universal coverage? Three, does the issue have a critical mass of advocates and legislators? And number four, does the issue have a core leadership of organizations of HCHR members that have a clear and realistic strategy for how we're going to pass the bill? It's mostly the same there as last year. Like I said, we've added that we've narrowed it a bit to make sure that the core leadership, we have folks in HCHR who are actually working on the issue. We are a massive statewide coalition of organizations in labor, but we can't do it all. So we do have to prioritize our energy. And if you'd like to follow along in terms of specific bills that we've already considered, you can click the link. I think they'll be adding it to the chat with specific legislation there. All right, next slide, Nathan. All right, and just a backstory here is that, like I said, we've put some bills through the filter, and we will continue to do so throughout the session, particularly as bills are pre-filed now before session begins, and then through session, as well as, of course, when and if Build Back Better passes. So we will keep adding to this. So here's our state agenda, and Emily will go over our federal agenda in a moment. Here we've got our 4 buckets again. Number 1 is make progress towards universal health care. And under that bucket, we've got advancing immigrant health equity. And that is, of course, part of the massive win from an immigrant-led coalition to advance access to health care for immigrants in our state. And then improve Medicare affordability and access for our elders and seniors. Next one is improve healthcare affordability and access while driving down industry profits. Some examples there, support efforts to, this is a really critical one, especially coming from our labor partners, to advance and support our healthcare workforce. This is a crisis already, but we know this has absolutely gotten worse during the pandemic. It has huge racial inequity implications, and so this is going to be a major highlight of the coming session. And we will be partnering with our labor partners to support their efforts there. Another piece is, of course, supporting prescription drug affordability, which, of course, is a big aspect in Build Back Better. But we have some opportunities here, such as with the Prescription Drug Affordability Board that Senator Kaiser is putting forward again this year. Protecting against surprise medical billing, that's going to be a bill that is trying to align Washington's existing surprise billing law with the federal law and making sure we can prioritize consumer protections as much as possible. So that's coming our way, and also continuing to address healthcare consolidation with a bill coming from the ACLU called Keep Our Care Act, which is adding to our consolidation review at the state level to ensure that any merger or acquisition that happens in our state cannot reduce access to care, such as reproductive care, gender affirming care, reproductive care, etc. All right, next slide, please. And this is our last page for the state agenda, and then I'll pass it over to Emily. And so advance racial equity and social determinants of health. Again, provider workforce, crucial issue to make sure that we are supporting our healthcare workers. We know we can't have access to healthcare without quality, well compensated, equitable staffing for our healthcare workforce. Nothing happens without them. So that piece, strengthening behavioral health system, absolutely crucial, especially as the pandemic continues. Support progressive revenue, such as the wealth tax to tax extraordinary personal wealth. Advancing immigrant health equity. And let's see, I think that one we already had up above. So great. I think that covers it, and would welcome any questions as well. And I'll pass it over to Emily to review our federal agenda.
Thank you, Sam. Well, I don't see any questions in the chat. So if folks can, and sorry, it's hard to negotiate a little bit with the Zoom. So if folks can please go ahead and put your questions in the chat, and then we'll make sure we pick those up at the end. Thank you so much. So I'll talk a little bit about our platform at a federal level here. And we've already heard tonight from Rachel about our dynamic federal environment. Many of our priorities are on the line right now as the Senate considers the Build Back Better package. So we wanted to build a policy platform that accommodate all the uncertainties in the congressional landscape that are happening right now. It's a little hard to set forth a policy for the next year with all that's on the line right now. So in keeping with our process for the state portion of the platform, we use the overarching goals that Sam mentioned to guide us towards some specific policy proposals we're hoping to support this year. First, we always want to keep our North Star in mind. And good, I'm seeing questions start to filter in, so that's good. We'll get to those at the end. Thank you so much. So we always want to keep our North Star in mind. Why are we here together? We are trying to make strong progress toward universal healthcare. That's why we are all here. And to advance this goal, we've suggested retaining 2 carryover bills from last year. The National Single Payer Bill, Improved Medicare for All, that's Rep. Jayapal's bill. This is our North Star. This is the bill that will bring us all into a national healthcare program. So that is at the top of every federal platform that we will have until it gets done. But we also have the State-Based Universal Healthcare Act because we're pragmatists. If Congress can't get it together this year on national single payer yet, at least they should be able to give states the flexibility to implement our own universal healthcare programs. So that's where Rep. Khanna's bill comes in. We supported this one too last year as well, which would give Washington the federal flexibility we need to move forward on our own at a state level through the new State Universal Healthcare Commission. So those are items that we continue to support. Even as we work towards our North Star goal here, we want to also recognize that there are other opportunities immediately before us to make change in the healthcare system and seize them. And that starts with improving affordability and access while we drive down industry profits, as Sam mentioned. We are hopeful that some of the items on our list may be covered as part of the Build Back Better package, but we may need to keep pushing this year if it doesn't get done in that package. So first, we've got enabling Medicare to negotiate drug prices, and we know the House passed Build Back Better includes some provisions to allow Medicare to negotiate savings in prescription drugs, but we need to fight to maintain and do even more. Second, we want to maintain subsidies created by the American Rescue Plan Act. That was that COVID response bill from early in the year. Of course, subsidies are not a long-term strategy to our affordability challenges, but we've seen that the enhanced premium assistance people are getting in our state under ARPA are making a huge difference right now in reducing uninsurance, bringing people into the system and easing affordability problems. So that's good. We also want to add an out-of-pocket maximum on Medicare cost sharing, right? The House passed Build Back Better bill included a cap on drug costs in Medicare, but it doesn't yet address the fact that there is no limit to the amount of out-of-pocket costs Medicare enrollees face, which is just really an injustice compared to what people in other markets have. So next slide, please. And okay, here we go. Good, keep those questions coming, very good. Moving on, so we're going to want to make sure that in all of our advocacy, in all across of our goals, we're advancing racial equity and addressing social determinants of health and disparities, as Sam said, but we also want to specifically lift up some targeted strategies at a federal level this year. For example, the House passed Build Back Better bill includes some really important proposals from the Momnibus and otherwise to address disparities in maternal health that disproportionately impact Black and Indigenous people. In addition, the House passed Build Back Better bill would include historic investments in Medicaid home and community-based services. That's really important for those of us who are caring for loved ones or will care for loved ones who are aging or experiencing disabilities. And it also includes measures to build that workforce with good jobs, which is important. Finally, we know that there's a lot that could change in the healthcare landscape between now and the end of 2022. We've got midterms looming, so we want to make sure that we are both working to strengthen our existing programs to build them up and also remaining vigilant that we don't lose ground while we're working on the fight for universal care. So we want to keep pushing on immigrant access. As Sam said, we will not let up until all our residents can access healthcare as a basic human right, regardless of immigration status. We want to be supporting conversations about lifting the 5-year bar and other draconian policies and doing even more at a federal level. We need to close the Medicaid coverage gap. This doesn't affect us in Washington, but we cannot forget about the 12 states who haven't expanded Medicaid a decade after the Affordable Care Act. Those states have been holding their residents hostage in one of the biggest injustices of our time. Expanding Medicare to include dental, vision, and hearing benefits. We have to strengthen Medicare so it meets the need of current enrollees and is ready for more of us in the future. Build Back Better would add a Medicare hearing benefit, but we have to keep pushing for dental and vision. And we want to keep pushing on lowering that Medicare eligibility age. This isn't in Build Back Better, but we want to keep looking for every opportunity to expand Medicare for folks who need it under 65, especially recognizing the high healthcare costs that people face as they age. Okay, next slide. So finally, when we looked at our policy platform this year, and we've typically stuck to legislative and congressional goals, we realized there were really important opportunities to advance our goals that might not be legislative this year, based on the current information we have, which could change, but needs strong advocacy nonetheless, and may build towards legislation in the next year. So first, we already talked about this and heard from Marcia about our state's Universal Healthcare Commission. We have an active work group that is developing advocacy strategies to maximize our strongest in the nation Universal Healthcare Commission, and we want to be building momentum in that process. Similarly, on the cost piece that Sam talked about, we have a new state board that's setting a benchmark for healthcare cost growth. That's a pretty exciting opportunity to hold industry players accountable for their excess profits. Next, we want to make sure that we are lifting up leadership presence and opportunities for communities of color in healthcare. We cannot get to where we need to be on equity unless we are doing that and unless our leaders are reflecting the beautiful diversity in our state. And finally, and I wish I didn't have to include this one, but we are still in a pandemic and it's going to be a long process to come out of it. We've got important pieces on the line about how Medicaid enrollees and others transition out of the public health emergency, and we want to make sure that we don't inadvertently lose access to coverage and care in that process when we, knock on wood, eventually come out of the pandemic. And I think with that, we have maybe a couple minutes for questions, and then we will turn it over to our voting process. And I see a couple in the chat.
I'm just reading them too. Yeah. Yes, Tracy, specific plans to meet these goals. Absolutely. I'm going to add in the chat our platform. It's actually got a little bit more detail than what we've shared in the slides, and it includes several bills that we're likely to support. Most of them have not actually been filed with the legislature, so officially we are waiting to see draft bill or the bill language once it's filed, so that we'll know more about of course, the devil is in the details. So we want to see what that is and decide if we can support them. One example is the Prescription Drug Affordability Board. That bill has been filed, and it's Senate Bill 5532, just as an example. And that would go a long way to addressing high prescription drug costs. For one thing, it would create a board that would create an upper payment limit for high priced drugs, which is really, really critical because, for example, drug companies have no limits to how high they can set their prices, which is a nightmare for patients. So that's just one example. And of course, as we enter into the actual session, we'll have a lot more details about specific bills that may or may not be advanced. So yeah, that we're mostly kind of trying to cover the high level buckets here, and then we'll know more about specific legislation in the coming weeks. Catherine, to your question, the asterisk is about when something falls into more than one bucket. I will let Emily speak to the Medicare Cliff piece because I know that her organization is covering that.
Yeah, thanks so much. Thanks. Good question, Catherine. And happy to talk about this more offline too. So what this is referring to is, of course, I think everybody in this room knows that Medicare, contrary to our dreams and expectations, is not free. As we talked about earlier, there is no out-of-pocket limit. People are facing actually extraordinarily high costs on Medicare, sometimes particularly when they're low income. States have options under federal law to expand Medicaid or related Medicare savings programs for people at the lower income side of things. And that those programs can wrap around Medicare coverage and are designed to kind of fill in some of those cost gaps in Medicare. So Washington is actually in the bottom quartile of states that have not taken action on this issue, and we'd like to move the conversation along because if we want Medicare for all, we need to make sure we've got a Medicare system and a system in place that is addressing those healthcare costs.
I will jump in here too, as well. If people are wondering how you can support our work, we will be sending out action alerts throughout session once we have everything finalized of the specific bills that we will be supporting. So, if you want to sign up to testify or want to sign in support of a bill or sign on to an action alert, we will have those opportunities aplenty starting in January. So that's one answer to a question, and that includes, let's see.
We want to just go in order. So Pam next.
Sure.
Most immediate labor actions for healthcare workers. So
we're running out of
this is a great question. I have not seen specific legislation yet, but I know that there are efforts from the labor movement to introduce pieces around nurse staffing ratios and making sure that we build a pipeline of healthcare labor workforce through apprenticeship programs and others. So I would, if someone wants to jump in and add more, welcome that. I know we've got some labor friends in the group, but I think that there was an effort that was unveiled earlier this week, particularly around staffing ratios and safety. And you can read about that in the stand, actually, if you get it. It's Sybil, you look, maybe anyone want to jump in? Okay. So I think what we're hoping to do is, as we see specific proposals come through, to put them through our filtering process that Sam talked about. And we're just kind of in the beginning phases of hearing about what might be coming.
Looks like we are running out of time, so maybe one more question. Is there something standing out to you? I can answer
maybe we can run through just real quickly. So is there space for advocating for mental health services that respond to crisis instead of police? Yes, absolutely. Behavioral health services bills were all over our work last year, really important. I would expect, I'm not yet aware of particular pieces of legislation that are coming forward, although I expect that there will be response bills to the Blake decision, et cetera, as Sam talked about, and that was called out in our policy proposal. So I think there's certainly room for that as we move through our filtering process and see particular proposals. It's a little tricky to weigh in on specifics at this point, where we are with the legislative session. Catherine asked a good question about why do we consider Universal Healthcare Commission as non-legislative, and I think we'll see how things go as the legislative session proceeds. I know we obviously share common goals with that effort, and we want to see legislation passed. Where we're sitting at this point, it does not look like there is a core leadership of HCHR membership that are coalescing around a particular bill coming out of that can make its way out of the policy committee, the fiscal committee, through both chambers in the House and Senate. I think obviously we'll continue to reevaluate that over the course of the session and always welcome information to that effect. What we do know is happening is, of course, the Universal Healthcare Commission. And I think the thought is that we'll be able to build real momentum, energy, and specific policy discussions in that space that will lead us to legislation perhaps next year. So that's, I think, the information that we have at this point, and obviously we'll be continuing to evaluate that during the session. Further ado, I will introduce our HCHR Interim Steering Committee co-chair, Jim Howe, who will walk us through the voting process. Jim, take us away.
It's my job to take us through the voting. Tonight we'll be voting only on the one proposed 2022 Healthcare is a Human Right policy platform. Initially, we proposed voting on other items, but we will come back in 2022 with recommendations for budget and fundraising goals from a new budget committee. If any members are interested in helping form the budget committee or know someone that might be, please contact Gina or Cheryl, and they'll be putting their emails in the chat. Before we commence the vote, let's explain how the voting will work. One designated voter from each sponsoring member organization may vote on our policy priorities. Because we are meeting remotely, we must hold roll call votes. I will call the name of the organization in alphabetical order and the designated voter from a list that we've already compiled here. Because of this, the steering committee just yesterday, without any objection, recommended this voting procedure. We know that some members may need to abstain or decline to vote in favor or for or against particular issues that they or their national affiliate have not endorsed particular bills. We understand this, and we did this before in this same method. We also want to say at this point that we want to be sure to say that we know that many of our member organizations do not have the scope or the capacity to work on all of the issues in our state and federal platforms. The value of our coalition is that we are stronger together and can bring our combined voices to advocate for our common purpose. In that spirit, we hope our proposed platform meets with our members' approval. So at this point, I need to ask David Loud, do we have a quorum?
Yes, we do. We have 38 of our 39 sponsoring organizations represented by their designated voters here tonight.
Okay, well, thank you. We have the quorum would be 26, so we're over the top. And the vote will be a majority rule, so 50% of those voting could pass the motion. So, do I have a motion? Lika Smith, do you have a motion?
Yes, I move that HCHR Washington adopt the proposed 2020 HCHR policy platform as presented tonight.
Thank you. Do I hear a second?
This is Gina Owens. I second that motion.
Okay, with that second, I open the floor for discussion on the motion. And I'll ask my co-chairs here to look for hands. Not seeing any, it's time to call for the vote. So as I said, I'll do this alphabetically by sponsoring organizations and read your names. Unfortunately, the first one in the alphabet could not send a representative today, so that's the Alliance for a Healthy Washington. And I don't believe any of them have a vote. So as I go through this list, get ready to unmute yourself so you can vote. Next one is the American College of Nurse Midwives, the Washington affiliate, and that's Sherry Van Hoover. How do you vote?
My organization votes yes.
Okay, did I explain that you can vote yes? You can vote yes with an abstention on a certain issue, and you can name that issue, or vote no or abstain.
You did, and we'll go with yes.
Okay. The next one is the American Federation of Teachers, and I'm Jim Howe representing the American Federation of Teachers here, and we vote yes. The next one is the Asian Counseling and Referral Service, and that's Michael Bion.
We vote yes.
Votes yes. Okay, the next one is the Asian Pacific American Labor Alliance Seattle, and Amy Leung.
We vote yes.
Next one is the Backbone Campaign, David McClanahan.
Backbone votes yes.
The next one is Carolyn Downs Country Doctor Community Health Centers, and that's Michael Craig.
We vote yes.
Next one is the Children's Alliance, and that's Charles Adkins.
We abstain.
The next one is the Community Health Network of Washington, and that's Hawa Elias.
We vote yes.
The next one is Doctors for America, the Washington chapter. That's Nancy Connolly.
We vote yes.
The next one is the Economic Opportunity Institute, and that's Sam Hatzenbella.
Thanks, and we vote yes.
The next one is the Faith Action Network, Washington, Kristen Ang. Kristen Ang, are you unmuted? I'm going to circle back on that. The next one is Healthcare for All Washington, and Ronnie Shore.
We vote yes.
The next one is the League of Women Voters of Washington, and that's Kim Abbey.
Yes, the League of Washington votes yes.
Next one is Machinist District 751 Retirement Club, and that's Jackie Beauchamp.
We vote yes.
The next one is the NAACP Seattle in King County, and that's Claude Burfict.
We vote yes.
The next one is the National Organization for Women, the Tacoma chapter, and that is Cheryl Wapsa-Mays.
Tacoma now votes yes.
The next one is also the National Organization for Women for Washington, and again, Cheryl is the voter.
Washington State now votes yes.
The next one is North Seattle Progressives, Maureen Bricklund.
North Seattle Progressives votes yes.
The Northwest Health Law Advocates, and that's Emily Bryce.
Northwest Health Law Advocates votes yes.
The Pacific Islander Health Board of Washington, Lika Smith.
We vote yes.
The Physicians for National Healthcare Program Washington, again, David McClanahan.
Physicians for a National Health Program, Washington votes yes.
Pride at Work of the AFL-CIO, and that's Mike Andrew.
Pride at Work votes yes.
Pro-Choice Washington, Emily Murphy.
Pro-choice Washington votes yes with an abstention on the state-based universal health care proposal. Thank you.
Thank you. The next one is the Puget Sound Advocates for Retirement Action, and David Loud.
Zara enthusiastically votes yes.
All right. The Retired Public Employees Council of Washington, and that's Gwen Wrench.
Our PEC votes yes.
The CMAR Community Health Centers, and that's Jesus Sanchez.
Sorry, I was muted. CMAR Community Health Centers vote yes.
The Seattle Indivisible, Paul Oldenkamp.
So Seattle Indivisible votes yes.
SEIU Healthcare 1199 Northwest, that's Rachel Erstad.
SEIU 1199 Northwest is yes.
The Somali Health Board, that's Mohammed Shadain.
The Somali Health Board votes yes.
Tacoma DSA, that's Tracy Murphy.
Tacoma DSA says yes.
UAW Local 4121, Mark Rafferty.
UAW Local 4121 says enthusiastic yes.
All right. The Washington Insulin for All, and that's Maddie Johnson.
Washington Insulin for All votes yes.
Washington Can, that's John Godfrey.
Washington Can votes yes.
The Washington Federation of State Employees, that's Cindy Hall.
Washington Federation of State Employees votes yes.
Washington Poor People's Campaign, and that's Ming Chen.
The Washington Poor People's Campaign votes yes.
Washington State Alliance for Retired Americans, and that again is Jackie Beauchamp.
Wasara votes yes, but abstains on both of the federal bills under the congressional agenda.
Okay. Washington State Labor Council, Sybil Hippolyte.
Hey, okay, sorry, I was trying to turn on my camera, but I can't. We vote yes, thank you.
And the last one, I'll circle back, but the last one on this list is Washington Working Families Party, and that's Margaret Carey.
Washington Working Families Party votes yes.
All right, is Christian Ang for the Faith Action Network?
Faith Action Network votes yes. Thank you.
Thank you. All right, I believe that's all the votes, and I'm going to ask for a brief pause here while I confer with Kelly and David, and we'll get right back to you with the result of the vote. The result of the vote on the motion to adopt the policy proposal was 36 voted yes, 2 voted yes with abstentions on particular items, and 1 abstention. So the vote carries.
Well done, everyone. Thank you.
Yes, thank you so much. We have incredible unity. I just love this. This is wonderful. It's great. Thank you so much.
All right. Thanks, everyone. I think y'all can see me, although I don't know if I'm spotlighted. Just going to run through this really quick. In the chat, we will be sharing a link for y'all to email your senators. This one's really simple. The email is really simple. Calling them 202-224-3121, 202-224-3121. That's our congressional hotline. You want to call Senators Murray and Cantwell, as you heard earlier from Rachel Berkson from Representative Jayapal's office. The urgency is on the Senate to pass the Build Back Better package, and we just want to keep up that sense of urgency for our senators. So, yeah, please click the link that is in the chat, and also make that phone call. So, thank you.
I get to close us out, huh? Our parting thought that we carry with us as we move forward into 2022. The chant actually goes, no healthcare, no justice, no justice, no peace. And that is the message I want us all to go out of this meeting with. I do want to say thank you to everyone who participated in the vote. I want to say thank you to everyone who stayed on for this long meeting process. And I think that everyone will be walking away with some pretty good information. Before everyone signs off, I just want to say a quick reminder, contact me or Cheryl Wapacia Mays. I think Margaret posted our emails in the chat. If you want to be a part of the budget committee, we will be taking everyone's information and getting together with our colleagues on that. Thank you, everyone. And I hope you all are pleased with the time you spent. With that, I want to say good night to everyone. Hope you have a great evening and a happy holidays. Thank you.
No healthcare, no justice, no justice, no peace.
Oh, yeah.
Healthcare, no justice, no justice,
No justice,
peace.
no peace.
That's
That's right. No
you.
healthcare, no justice. No justice, no peace. No salud, no justicia, no paz.